Diabetes Mellitus, Sharnice Woods, RN, BSN, University of Memphis, Nursing 7103 M51, Advanced Pathophysiology, Dr. Jane Cash. Case study. A 38-year-old African American female presents to clinic today requesting to be checked for sugar. She informed provider that she has been thirsty for weeks and drank 3 large cups of pop today. She also did state that sugar diabetes runs in her family heavily. Patient stated that she urinates frequently throughout the night and she has a slow healing sore on her toe from bumping into the door. She recently was prescribed glasses, but she hasn't received them yet. Background. Patient is a 38-year-old overweight African American female. She is pleasant, well groomed, but anxious. Poor historian. She complains of extreme thirst and a non healing skin issue. Patient does not exercise. Patient reports drinking 2 glasses of wine 4 to 5 times a week. She stated that she is a junk food queen. Patient is a gravida 2 para 2. She was diagnosed with gestational diabetes during second pregnancy. Currently, she does not take any medication. She is self-employed. Patient denies tobacco use. No previous surgical history reported. Maternal family history of hypertension and diabetes mellitus type 2. Patient is unsure of paternal history. Assessment. Alert and oriented ×4. Skin is warm but dry. Pupils equal, round, reactive to light and accommodation. Wears corrective lenses but not present. All pulses are present and strong. Vitals are BP 144/96, heart rate 101, respirations 20, temperature 97.9 oral, O2 at 96% on room air. Lungs are clear and denies shortness of breath. Patient weighs 236 pounds and is 5 feet tall. BMI 46.1. Abdomen is round but soft. Bowel signs are present in all quadrants. Moves all extremities without difficulty. No edema present. Dime-sized laceration noted to right great toe. Glucose monitor reads high when Accucheck performed in clinic. Recommendations. Recheck blood glucose level stat. If greater than 500, administer 16 units of Humulin R subcutaneously, times 1 dose, and recheck in 1 hour. Patient is to remain at office until furtherly instructed. Humulin R is a regular acting insulin with an onset of 30 minutes. This medication is administered in fatty tissue due to the absorption rate. Lowering a blood sugar too fast can be as harmful as having an elevated blood glucose level. Patient is to be NPO after midnight. Fasting labs in AM, hemoglobin A1C, CBC with DIF, BMP, lipid profile, prealbumin. Patients must be reminded that it is necessary to remain NPO to ensure accuracy of test results. Hemoglobin A1C is a key lab test in diagnosing diabetes mellitus. Findings. Patient's blood glucose level was rechecked and monitor read high. Patient was given 16 units of Humulin R subcutaneously as ordered. After 1 hour, blood sugar was rechecked and noted at 294. At the 2-hour mark, blood sugar was noted at 188. Patient labs revealed hemoglobin A1C of 10, creatinine 1.5, BUN 29, and hemoglobin of 9.8. Hemoglobin A1C is indicative of blood glucose levels from the past 3 months. This patient's hemoglobin A1C was 10. Normal range is 4 to 6. She is suffering from hyperglycemia. Her creatinine and BUN are slightly elevated. These results indicate if there is damage or diseases affecting the kidneys. Initially, patient was prescribed metformin 500 milligrams, 1 tablet by mouth, 2 times a day with breakfast and dinner for hyperglycemia. Metformin is a drug that is commonly prescribed for treatment of diabetes mellitus. It can have unpleasant side effects. After results were received, ferrous sulfate 325 milligrams, 1 tablet by mouth, 3 times a day for anemia was ordered. She also suffers from anemia. This can be corrected with oral iron supplements. Patient ordered to record and log blood pressures for 2 weeks twice daily. Patient educated on pertinent dietary and lifestyle modifications. Tiffany's risk factors. Obesity, her weight is 236 pounds and her BMI is 46.1. Her BMI for her height should range from 19 to 24. Hypertension. Her blood pressure was 144/96. Normal blood pressure range is 130/80 or lower. Heredity. She has a maternal family history of diabetes mellitus type 2. Diet, she reported a junk food diet. Alcohol consumption, she consumes wine 4 to 5 times a week. This slide just gives examples of junk food. Previously, sodas and fountain drinks were referenced as pop by this patient. Pathophysiology. Diabetes mellitus is a class of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. Pathophysiology continued. Food is broken down into glucose and is released into the bloodstream. This disease causes high blood glucose levels. When blood sugar levels increase, the pancreas is stimulated to produce and release insulin. The insulin allows the body's cell to use the sugar as energy. Within diabetes, there is either insufficient insulin production or lack of response. In diabetes, fatigue is a common complaint amongst patients. Glucose is not being used as energy due to the issues with insulin. This is a flow chart of diabetes mellitus type 2. This connects heredity with environmental factors such as obesity, which in turn causes insulin resistance and hyperglycemia. Also, an increase in hormones can stimulate increased glucose output. Diabetes is one of the main causes of death. Diabetes is commonly called sugar diabetes, sugar coma. It is important to be aware of slang terms used to describe a disease process. We as providers may frequently have to use patients' lingo to ensure a proper understanding of the information. Statistics of diabetes. 34.2 million people have diabetes. That's 10.5% of the U.S. population. 26.9 million people have been diagnosed. 7.3 million people have diabetes but have not been diagnosed. Pre-diabetes, 88 million people aged 18 years or older have pre-diabetes. That's 34.5% of the adult U.S. population. 24.2 million people 65 years or older have pre-diabetes. This picture exemplifies all the components and ingredients of diabetes. There are 3 main classifications of diabetes mellitus: type 1, type 2, gestational diabetes. These are the classifications that most people are familiar with. Characteristics of diabetes mellitus type 1: complete insulin deficiency, insulin dependence, commonly not related to lifestyle. Patients are at a high risk for DKA, common in juveniles, autoimmune, sudden onset, destruction of beta cells. Beta cells are the insulin producing cells within the body. Characteristics of diabetes mellitus type 2: progressive decrease in the production of insulin, treated most with oral hypoglycemics. Central obesity, heredity, and lifestyle can be causative factors, develops over a span of time. Gestational diabetes occurs during pregnancy due to lack of insulin production due to hormonal and weight changes. Women frequently do not have diabetes diagnosis. They develop insulin resistance. They are at risk of having larger babies. Infants may be hypoglycemic at birth or develop diabetes in the future. Glucose tolerance test is usually performed around 24 to 28 weeks mark. Glucose tolerance test is an oral glucose test in which patients ingest an oral glucose solution, and at the 2-hour mark, a blood sample is taken. Results should be less than 200 if diabetes is not present. Manifestations of diabetes mellitus are polyuria, which is frequent urination, polydipsia, which is increased thirst. Those 2 are the most common manifestations that patients present with. Fatigue, pruritus, recurrent infections, visual changes, neuropathy, coronary artery, peripheral artery, and cerebrovascular disease. Diabetics occasionally will present with slow healing wounds due to disease in arteries. Weight loss is typical in patients who suffer with diabetes mellitus type 1. Next, we have some of the treatments for diabetes mellitus type 1. That includes diet modification, exercise, insulin therapy, and blood glucose levels monitoring. Diet modification and exercise are essential for controlling blood glucose levels. Neither will treat type 1 diabetes. Depending on the provider, the patient, blood glucose levels, different types of insulin may be prescribed and used in different combinations. We have listed different types of insulin. They vary from onset, peak time, duration, type. They range from rapid acting to long acting. All insulins can be mixed except for the long acting and ultra long acting insulins. It's important to know the saying, clear before cloudy, to understand how to properly draw up insulin. Some of the common names of insulins are Novolog, Humalog, Novolin R, Humulin R, Novolin N, Levemir, and Lantus. Some of the treatments for diabetes mellitus type 2 range from diet modifications, weight loss, exercising, oral hypoglycemics. It may require insulin also, blood glucose monitoring. Some of the most commonly used oral hypoglycemics that I've seen in practice are metformin, glipizide, glyburide, Januvia, and Actos. Treatments for gestational diabetes are monitoring of blood glucose, diet changes, being active, becoming active, or remaining active, tracking the baby and its progression. Next, we're going to talk about some complications of diabetes mellitus. The Samagi effect is a hypoglycemic episode during the early morning from an excess of NPH or intermediate acting insulin during the evening. Treatment for this is to decrease evening insulin, intake less carbohydrates. Dawn phenomenon is characterized by episodes of early morning hyperglycemia caused by nocturnal elevations of GH. This causes a reduction in glucose metabolisms. Providers may need to increase insulin dosage during the evening. Hypoglycemia is characterized by blood glucose less than 47 milligrams per deciliter, termed as insulin shock. It's a result from activation of sympathetic nervous system or lack of glucose to the brain. Patients may present with confusion, cool, and clammy skin. Diabetic ketoacidosis, commonly termed as diabetic coma syndrome, results from decrease in insulin and increase in the levels of insulin counter regulatory hormones. DKA is manifested by Kussmaul's respirations, which are fast, deep, and labored respirations, and fruity smelling breath. This diagram displays consequences of chronic hyperglycemia and type 2 diabetes mellitus. You see anywhere from adipose tissue being affected to your liver, digestive system, kidneys, muscles, brain. Also, it can cause gastroparesis. It can cause issues with your eyes, put you at higher risk for hypertension, PVD, stroke, heart disease, neuropathy, cancer, decreased cognition. So uncontrolled hyperglycemia can affect multiple organs and systems within your body. Diabetes prevention is extremely important. I'm going to discuss a couple of methods, a couple of factors that can be altered or modified in order to try to prevent diabetes. First, we're going to talk about maintaining a healthier weight. Next is healthier eating, decrease carbohydrates and alcohol consumption, increase water intake. Also, it's important to incorporate exercise into your daily schedule. Manage stress, restrict sedentary behaviors. Let's revisit Tiffany, our patient. Tiffany's summary. Tiffany presented with classic signs of diabetes mellitus. She was thirsty and urinated frequently. Tiffany was at a high risk of developing diabetes because of family history, lifestyle, and gestational diabetes that was diagnosed during her second pregnancy. It is pertinent for Tiffany to engage in lifestyle modifications to gain control and regulate blood sugar. Metformin is usually the initial drug of choice for newly diagnosed diabetics. She must also watch her blood pressure and hemoglobin. These issues could predispose her to other more serious conditions. If Tiffany doesn't manage her diabetes mellitus type 2, it can transition to diabetes mellitus type 1. Also, she is possibly suffering from diabetic retinopathy. She was just prescribed glasses for vision issues. A referral will be made for wound care for the management of the toe laceration.